Hi, I'm Dr. Bhavik, and I want to talk to you about one of the most underrated, underprescribed, and quite honestly, one of the most effective treatments for a lot of different conditions, and that's strength training. So, as a physical therapist, I incorporate strength training in every one of my cases and with all of my patients. And strength training is the foundation behind how I treat every single patient, regardless of shape, size, medical condition, fitness levels, strength levels, mainly because strength training is one of the most effective ways to rehabilitate somebody, but there's also a multitude of other secondary benefits of strength training, and that's what I want to talk to you about today. The incredible thing about strength training is that it has effects on your entire body and not just your muscles. So here are some of the main benefits of strength training outside of getting stronger. One, your bone density will improve. So if you have osteoporosis, osteopenia, or other conditions like that where your bone density might be a little bit weaker, strength training is a really effective way to either slow down the progression of these conditions or to increase the bone density so you can prevent your conditions, your osteoporosis or osteopenia from getting worse. Two, it actually makes you smarter. So strength training improves your cognitive and brain function. So some of the things that happen when you strength train include preventing the onset or the progression of dementia or Alzheimer's disease. In addition to that, strength training also improves your focus and your attention. Three, strength training can make you happier. Strength training helps your brain release mood-enhancing hormones that improve your sleep quality, makes you feel happier, and it also can reduce the symptoms of depression for a lot of people. Not only that, strength training is also a great exercise for your heart. So people who strength train and incorporate weightlifting and other types of strength training into their exercise routine, they have a lower risk of developing heart disease or cardiovascular disease. In addition to that, they also help improve their blood values for their triglycerides and their cholesterol levels. Despite how awesome strength training is for heart disease and cardiac health, it is still very underprescribed as a treatment option for people with heart disease. Number five, strength training can help you lose weight. And yes, weight loss is one of the intended goals of strength training and weightlifting and exercise in general. However, when you lose weight, it also has other benefits. Number one, it can reduce the symptoms or onset of arthritis, and it can also help improve your insulin sensitivity. So if you're pre-diabetic or have diabetes, if you lose some weight with weightlifting, it actually improves how the insulin in your body functions, and it can also help reduce your A1C numbers and your blood glucose levels as well. And finally, strength training also saves lives. One of the leading causes of death and mortality in elderly people is falling and fracturing your hip. So strength training is a great way to improve your balance. It's also a great way to improve your bone density. It's also a great way to learn different ways to use your body so you have a lower risk of falling down. But if you do fall down, it's also going to improve your ability to recover and rehabilitate and get back to walking rather than being bedbound. And that's how most people die from a hip fracture. They just become bedbound. Strength training can be a great way to prevent that from happening in the first place. So in conclusion, strength training has incredible benefits outside of just getting stronger. To summarize, it can make your bones stronger, it can make your brain smarter, it can help you be happier. It's great for your heart, great to lose weight and also improve your diabetes. Finally, strength training can save your life by improving your balance and preventing you from having a fall in the first place. So now that we talked a little bit about strength training, how can you incorporate this into your daily routine and your daily lifestyle? Well, I highly recommend everybody speak to a physical therapist, get evaluated, have your physical therapist take a look at your entire body and help you learn about the parts of your body that are a little bit stiff or a little bit weak that can improve with specific stretches, specific exercises, so that when you weight lift, you can do so without developing aches or pains in certain joints or muscles. Most physical therapists will also be very well versed in teaching you how to weightlift properly and safely with good form, good alignment, and without risking injuring other structures. So, what can you do to improve your health in a multitude of ways? Number one, strength train. And if you need help strength training, consult your physical therapist and you'll be able to take advantage of all of these health benefits of strength training.